I want to start with a confession. I love a tidy explanation, a label that makes the mess make sense. But lately, I've noticed something. Diagnosis has become a kind of social currency. It travels faster than nuance. Here's the hook. What if the story you're telling about your mind is accurate, but incomplete? There's a myth. If I can name it, I can fix it. If I can claim it, I can belong. Online, I see checklists distilled into 15 seconds. Traits severed from context. Algorithms rewarding the stickiest labels. We're encouraged to swap "I'm tired," "I'm burnt out," "I'm shy," "I'm socially anxious." Everyday grief, a permanent identity. Labels feel like landing, but sometimes they're just a layover. Diagnosis can be a lifeline. It can unlock treatment, accommodations, language that turns chaos into a plan. The problem isn't diagnosis, it's diagnosis without depth. Here's a quick framework I use to reality check a label. Pattern. Is this persistent across time or just a rough week? Track it for 30 days. Impairment. Is it meaningfully disrupting work, school, relationships, or self-care? Context. Did something change? Sleep, stress, substances, grief, meds, hormones? Spectrum. Traits exist on gradients. Where am I on severity, frequency, and duration? Echo. Do people who know me well notice the same thing across settings? Professional. Have I talked to someone trained to rule out lookalikes and comorbidities? Many conditions mimic each other. Anxiety can look like ADHD. Sleep debt can look like depression. Trauma can look like almost anything. A label you pick up from a reel can feel true because you start looking for it. Confirmation bias. So, how do I use labels wisely? I hold them lightly. Helpful until they're not. I use people-first language. I have, not I am. I pair labels with action, sleep, movement, routines, therapy, community, medication, when appropriate. I expect updates. As data changes, so does the map. Another myth. If I don't have a diagnosis, my pain isn't real. Not true. And one more. If I do have a diagnosis, I'm defined by it. Also, not true. A label is a tool, not a destiny. Here's my invitation. Chase understanding, not identity. Ask better questions. Track real data. Get qualified eyes on the pattern. Your brain deserves more than a buzzword. It deserves a framework and a future. If this helped, share it with someone who's scrolling for answers. Then, maybe, pause and check in with yourself, not just the algorithm.